about a former NBA player's battle with addiction and his journey of recovery. And Nancy Beckett-Lawless joins us to discuss communities of solutions.
And in Suffolk County communities, we got together and a group of stakeholders came together that were police departments and schools, treatment providers, community coalitions, youth groups, and began to meet on a regular basis to see what we could do to improve quality to access and treatment.
And we revisit the segment on Talbot House. Hello, I'm Art Flesher from Suffolk County Health Department's Division of Community Mental Hygiene. I'm your host for Something of Substance, a monthly video magazine. Welcome back. Each month, we show how substance abuse, mental illness, and developmental delays affect you, your kids, and your community. We'll also give you a few examples of how services in Suffolk County help people find the inner resources they need to tackle their problems.
I had no idea it was going to be so hard. I didn't know what to expect. You hear the stories, but I never took any of it seriously until I found myself here. And then I realized I was going to have to work hard for my recovery.
If you or someone you know has a drug or alcohol problem, you are not alone.
Recovery was the hardest job I ever had, and the most important.
Chris Herren is a former NBA basketball player. He's been drug and alcohol free since August of 2008 and has refocused his life, putting his sobriety above all else. He recently teamed up with the Mariches in the Know Community Coalition and spoke on behalf of the Summit Behavioral Health Care Company to share his story at a local high school.
Because of my background, I believe that opens the door for me to get in front of kids. It is then up to me to be relatable, and it's up to me to get kids to trust in the message, understand where it comes from. And I think when I walk out of speaking in front of kids, they don't even remember Boston Celtics. They don't even remember the NBA. I think what they remember is that I understand what struggle is, and I have empathy for what they're struggling with. I think that's what's key to kids.
One of the reasons why we chose Chris Herren is so that a high-profile person like Chris can have a lot of influence over the choices that children make. They view him as a hero, they view him as a role model, and so it's very important for him to share his experience as far as what led him down the road to making the choices that brought him to addiction, and then of course we want him to share his message of recovery and treatment.
The event came about today because we are fortunate to have Chris Herren as an executive partner of Summit Behavioral Health, and we'd like to bring him to Suffolk County to help raise awareness and education for the community.
You know, what was it like being in the NBA? It was a challenge. It was a dream. Unfortunately for me, I was battling substance abuse when I finally was able to reach that dream. So I wasn't able to sustain it.
Sports, we think, is such a common denominator. If you look at the world of sports, there are so many icons, and so many of our youth look up to sports figures. So to see somebody like Chris Herren, who has had a relatively successful career and then all of a sudden has derailed himself through substance abuse and now is back on the road to recovery, is a really powerful connector, I think, to students, and something that they can relate to.
We want to, with Mariches in the Know, raise awareness within the school to promote prevention for drug abuse, and then of course treatment for those who are suffering greatly.
It doesn't discriminate. Addiction can touch anybody.
You know, I grew up a Celtics fan. I grew up wanting to be a Celtic, and when I finally became one, I was struggling mightily with OxyContin.
Chris is important as a presence because of his background. It opens doors. You know, his story is really no different from a lot of people that suffered from addiction, but having the NBA experience, ears open up, especially with the youth. He resonates very loudly with the youth of our country.
I think substance abuse for me began like it does for most. I think it starts off with a couple of beers at 14 years old, scared, don't get caught, not scared. Smoke a little pot at 14, thinking that's where it begins and ends, and it kept going. You know, at 18 years old, I was playing big-time college basketball in the Big East. I tried one line of cocaine, and it took 14 years to walk away from it.
A lot of our students here in our community are athletes. Probably about 60% of our high school population participates in sports in some way. And so it's a very important aspect of their life, and I think that's really where the connector is. And he's somebody that they can look up to and respect and really admire the struggles that he's gone through, that they may be going through themselves right now. And you know, it's a way for them to know that there is a way out.
You know, at 22, playing for the Celtics, I became dependent on 1,600 milligrams of OxyContin a day. It's $25,000 a month drug habit. That wasn't the intention when I opened those first couple of beers when I was 14.
Prevention is a very important aspect in the fight against alcohol or addiction in general, alcohol abuse, drug abuse, because we often know the end game when people have hit bottom, a tragic accident. We don't educate everyone when it starts with that one drink.
You know, I started this 4.5 years ago, 5 years ago, and I started this with the intention to try to inspire people struggling like me. And my passion turned into prevention because I look into the eyes of kids who want it, but they don't know how to get it. They want to prevent, but they don't know how to. And I think it's extremely important for us to get out in front of these kids and start teaching them different.
I hope that today's attendees will see that there is hope out there, that if you're somebody who's struggling with substance abuse, here's an example of someone who was a success. Their substance abuse affected their career. They've had to now come through recovery, and now they are having a productive life in a totally different way on the other side. And so I think hope is a big message today.
My memories of the NBA are much better today at 6.5 years sober than they were when I was struggling in substance abuse. You know, I'm grateful for the opportunity to play, and it's also given me a voice on this topic.
One of the things that we would like to have today's attendees walk away with is more knowledge about prevention, and that prevention does work.
I believe people will walk away from Chris's speech today with an awareness and knowledge that addiction does touch everybody. However, recovery is possible. There's always hope. He's been in recovery now for 6+ years, and you can always turn your life around.
I just hope people walk away with a new thirst and a drive and empathy towards people who are struggling.
Should there already be someone suffering from addiction, that there is hope, there is recovery, and treatment does work.
I think the other aspect of it too is that we hope that anybody who's struggling with substance abuse, or who maybe knows somebody who's struggling, that they're going to feel more free to speak out about it and to reach out for help. There are resources in our community, and we're hoping that they will see that and that they'll pick up the phone, make that phone call, or ask a friend and try to get some connection so that they themselves or whoever they know who's struggling with abuse can get some assistance.
You know, one of the things I'm most proud of is that for the last 6.5 years I haven't had to change myself. And I don't care who you are, that's a battle. Trust me, there's been many days I'd like to take a time out, make a pit stop. But for 6.5 years I haven't had to. And I take great pride in that. I take great pride in that for the last 6.5 years I've been the same person, not influenced or affected by any substances. And there's something to be said for that. And I'm proud of that. And I think more people in recovery need to stand up and say that, you know, we're fighting the fight, and it's not easy, but it's something to be proud of.
We'd like to thank Chris Herren, Summit Behavioral Health Care, and the Mauritius in the Know Community Coalition for sponsoring this presentation. For more information about this or other upcoming Community Coalition activities, please contact the Prevention Resource Center at area code 631-608-5014. Up next, Nancy Beckett-Lawless from Seafield Center joins us to discuss Communities of Solutions. We'll be right back.
Who else has been taking your prescriptions? Keep your medicine and your family safe and secure. Mind your meds. To learn how, visit the partnership at drugfree.org.
Nancy Beckett-Lawless is the Director of Provider Relations for Seafield Center and an integral member of Suffolk County Communities of Solutions Committee. She's here today to tell us about its purpose and the initiatives of the Communities of Solution. Nancy, thank you so much for joining us.
Thank you, Ed. It's great to be here.
Great. Communities of Solutions has had a number of great accomplishments, but why don't you start by telling us how it began?
Okay. In 2008, providers throughout Suffolk County received a letter from the Commissioner of OASIS. At that time, it was Karen Carpenter-Palumbo. And she wanted to bring communities together to talk about what areas that they could improve access to quality and treatment, prevention and recovery services. And in Suffolk County communities, we got together, and a group of stakeholders came together that were police departments and schools, treatment providers, community coalitions, youth groups, and began to meet on a regular basis to see what we could do to improve quality to access and treatment.
And basically you were looking at data at that point that the state would provide in terms of what was going on locally?
We did. Every treatment provider in Suffolk County enters data into OASIS's system. And at that time, we looked at the data and compared it with data that they were receiving from other parts of the state and other parts of the country. And what we realized was that we needed to focus on adolescent services because not as many adolescents in Suffolk County were actually getting to treatment as the norm would indicate needed to be in treatment.
So you focused on that, and I understand you had an event where, which really you met with kids, and you kind of did a focus group with them, and they said, amazingly, the people that they would most likely confide in would be a coach. And so you had an event with coaches as well? We did.
We had that about a month and a half ago. We got together 150 athletic directors from every high school in Suffolk County and educated them on what they could do if someone came to them and said that there was a problem of alcoholism or drug abuse for themselves or for their friends. And it was well received, and it was a great event. And as I understand, you've also spent a lot of time looking at resources and collecting resources and kind of working with other systems. Talk about that. Okay. We received a phone call early on from a police department that had an overdose in their area. And they wanted to be able to have something that they could carry in every patrol car and give to a family member when they ended up going to a family home where someone had overdosed. At that time, we realized that they probably needed something that was going to be specific to that area. So Communities of Solution put together what we called a police resource list for that specific area. And it would be all of the treatment providers and the levels of care that were offered and could be accessible just to that specific precinct. We then realized that it was something that was needed by others, and we reached out to other precincts and said, if you had a tear-off pad that was a resource list of what services were in your area, would it help you? And they said yes. So we planned for 10 police precincts and the East End townships and created police resource pads that were distributed to everyone.
And how were they received? Do you get the sense they've been used?
We've been asked to go in and have community meetings as a result of it, and they've called us and wanted more precinct pads, so they're being currently used.
Well, that's great. And of course, what makes it unique is they're a resource list, but usually it includes every provider in the county, and it's not broken by region or by precinct. So that was kind of innovative on your part to do that as a group.
And Art, I think what it also included that they didn't have before was the ages of the people that we could serve, so that they knew that there were places if someone was 14 years old that could receive treatment in Suffolk County. So it was the levels of care, the location of where the service was provided, and the ages that it served.
And then I understand you also adapted that and did the same thing with hospitals, more or less. Were they broken down by hospital geographic areas?
We did. It was another initiative. OASIS asked us if we would reach out to the hospitals and let them know what services were in their area. And we realized that as the police precinct pads, if we had something that was specific to each hospital in Suffolk County, it might help them. And we went into the hospitals, asked them if there was a need, if they could use that. They said yes. And Bridgehampton National Bank sponsored both the police precinct pads and the hospital resource pads. So now every hospital in Suffolk County has their own resource pad that they can give out, tear off a page and give it to a client upon discharge.
Sounds great. And as you've gone along, has the interest among the stakeholders in communities of solutions, has that stayed strong, would you say?
Art, I think we add so many different tasks every single month that there's been, it's grown instead of decreased in interest. Recently, what we've realized was that there in Suffolk County, the Suffolk County Police and the emergency medical technicians are doing an incredible job reversing overdoses with a drug that's called Narcan.
Yeah.
And they really are a pilot project now for the state and the nation with a number of overdose reversals. But many of those same people that have an overdose reversed are not making it to the next level, which would be prevention or treatment so it doesn't happen again. And Suffolk County Communities of Solution is looking at that issue. What gaps are there in the system, and how can we fill some of those gaps so that persons who have an overdose reversal will get to where they need to be so it doesn't happen again.
And I know that Communities of Solutions held not one but two forums recently regarding this issue, and it was also tremendous turnout. Everybody's very motivated to look at the issue of it's great to save somebody's life, and we all agree that that's essential to do, but there's kind of an opportunity that's being missed here, don't you think?
Definitely, Art. There's an opportunity because oftentimes the family members they're not aware of what's happening, and they don't know the risk when their family member overdoses that it could happen again. So we have an opportunity now to educate the community and let them know that there are things in place like the Good Samaritan law. If someone calls a police or an ambulance, if they come upon someone who has an alcohol or a drug crisis, they can make that phone call.
Are Communities of Solutions meetings open to the general public? Are they limited to stakeholders in the treatment and prevention field, law enforcement, healthcare?
We'd welcome anyone who would be interested in coming to Communities of Solution to our meetings. They're held the third Monday of every month from 11 to 1, right here at the county office buildings, Suffolk Community Mental Hygiene Services. If anyone is interested in attending our meetings, they could give me a call at Seafield. My number at Seafield is area code 631-288-1122, and we'd get them on the mailing list and they'd be invited to every meeting we have.
Nancy, thank you so much for joining us today. It's been a pleasure.
You're welcome, Art.
Appreciate it. For more information about the Communities of Solutions, aside from the number that Nancy gave, please contact my office at area code 631-853-8500. Up next, we revisit our segment on Talbot House. Stay tuned.
They'll be fine, I hope.
What if you could prevent a young person from getting hurt or killed?
What should I do?
If you could turn back the clock and stop an underage drinking party from ever happening. Now you can. Pick up the phone and call 1-866-UNDER-21. It's your community, your call, and it's completely anonymous.
Talbot House is a program provided by Catholic Charities and funded through the New York State Office of Alcohol and Substance Abuse Services. They offer short-term crisis services, 24 hours a day, in a residential setting for individuals whose lives have unraveled due to addiction.
Talbot House is the Chemical Dependence Crisis Center for the Suffolk County. We are certified by OASIS, and we care for people 18 and older, both men and women, who are in crisis due to their substance use.
A lot of people can't get sober just by going to a 12-step meeting in the community, so this is a great place for them to start. We're medically monitored withdrawal. People suffering from all sorts of addiction can come here to start their recovery.
We're covered by a federal law of confidentiality, so we could not let anyone know that a client is here unless the client signs a written permission. That includes law enforcement, parents, family, everybody.
As the program coordinator, I oversee the facility. I make sure that the facility is running within the OASIS regulations. The budget, we're within the budget. The clients are receiving the services that they're supposed to receive.
We accept clients 24/7. They can stay up to 7 days for sobering up services and up to 21 days if they're going on to treatment.
People know about Talbot House through parole, probation, child protective services. A lot of them are from the court system. A lot of them are from the 12-step fellowship. When they're trying to get people sober, they refer them here because they know about it through the community.
There is no average type of client that comes in. We see all different kinds of clients of all backgrounds, all needs of, and it's all chemical abuse that they have, alcohol or other substance abuse. So we never know, it's a variety of people. The ages have to be from 18 to whatever.
There are males, females, people who have their families still intact, other people are homeless, unemployed, also suffering from alcoholism, addiction from opiates, crack, pills. So it's a wide variety of people that come through Talbot House for help.
It's a voluntary program, so they have to want to come in here.
We're a crisis center for those people who are in crisis due to their substance use. Either they're in mild withdrawal, or they don't even have to have withdrawal, but they want to come in. They might be in danger of picking up. They might have used a few days ago, but they're afraid of picking up again.
Somebody's trying to come into Talbot House for help. It starts with a phone call. They call us. There is a screener in place. The person asks the person trying to come in what substances they're addicted to, medical concerns, if any, medications if they have, if they're involved with the legal system.
No insurance is needed, no payment. They can call us at any time. There is always a staff person here to take their call. When somebody does call, we do a screening, a thorough screening, and the purpose of the screening is to see if the client is appropriate for this setting, if it's a safe setting for them to be here.
If they are eligible for the service, and they usually are, and we have a bed, we bring them in the same day, and they arrive here at Talbot House, and they come into the foyer, and the nurse brings them in and does a full medical assessment. And if they're appropriate, they stay with us. The clinical staff comes in and does the clinical portion of the admission, tells them what Talbot House is about, takes them on a tour of the facility. A lot of times they're put directly into bed because they're still either under the influence or sometimes in withdrawal and need to be in bed. And while they're here, they're assessed on a regular basis by the nurse to make sure that they're safe during their withdrawal. And when they've been here, I think it's 72 hours, but it lands on their 4th day, the team and the client come up with a course of action for their continued recovery. And based on them agreeing to it, we will hold them here while we place them into the next level of treatment. And that could be rehab, it could be going home to their family, it could be housing, an outpatient, whatever they need, we'll do that while they're here with us.
Up to 60% of our clients go on for further care, and we connect them to that care, whether it's inpatient rehab, outpatient treatment. Some of them need housing issues, so we try to connect them with housing. We try to set them up for the next step.
If the client is not on bed rest from the nurse because of the withdrawal, we expect them to get up and start living life. So they get up, they shower, they have a meal. We give them housekeeping assignments and get them involved. They go to 2 12-step meetings. We provide group and education. They see a counselor for individual.
When a person comes in, and it varies the number of days depending upon what the services that they need. It could be the 3 days that they're coming in for a crisis, or they're coming in for a holding bed that they may be going to another facility. We do have an assessment of what their needs are from where they can go from here. So it does vary. They can go to outpatient, they go to inpatient, they go home, they can go to a private doctor for substance abuse. So it does vary upon the individual's needs.
To be eligible for Talbot House, we just have to make certain the person is able to be here safely.
A crisis center is quite unique. We're the only one here in Suffolk County, but we do provide services throughout Long Island. And it is more of a triage. It's like a hospital that people are coming in off the streets, they're coming using the drugs. Now, they don't have to be using drugs to come in here. If they're in a crisis of going to pick up, they can come here for several days. So it's, of the needs of coming in is what is going to be evaluated first to see if they're appropriate. It's a withdrawal and stabilization. It's not like the hospital with a managed care or a higher level of care.
Talbot House is well known in the community. A lot of people that are in the 12 steps get referrals, people coming trying to get sober from their addictions, and they're referred here through that way. Also, the legal system is a big referral source for us.
The gratification that I and all my staff get is that the person is alive. If they have to come back, because we do have a high recidivism, that we're here for them. And hopefully we can continue that, the way the budgets are and everything else, that we're here for the people who need the help.
We'd like to thank the dedicated staff at Talbot House for providing this valuable resource to those suffering with alcohol and substance use problems. For more information about Talbot House, please give them a call at area code 631-589-4144. We'd like to thank our viewers for tuning in to Something of Substance. Our video magazine is a public resource, and we're eager to hear your feedback, as well as any suggestions you may have for future show topics. For all inquiries and concerns, please contact me at art.flesher@suffolkcountiny.gov. I'm your host, Art Flesher. Join us again next month for more of Something of Substance.